I'd like to thank Ederlyn and Melissa for graciously volunteering to come up and do a role-playing activity. And as they're coming up, I want to let everyone know that our expectations for the activity are that Ederlyn and Melissa do act as if they were on the shift, and that they interact together in a professional manner, and they speak as if they were working together. And then also I want to challenge Ederlyn to think out loud so that we can understand what she's, how she's making her decisions and her thought processes. So those are two things that I'm going to ask of the two of you ladies. Also, we're going to be videotaping so that we can use the videotape after for our debriefing as a very important part of this role-playing activity. So any questions before we start? Okay. So I want to give you your scenario and your patients. So Ederlyn, in room 402, you have a 12-year-old boy who is a post-op spinal fusion, 5 days. The patient is on a regular diet, is mobile, he has a wound dressing that's clean, dry, and intact, and he's going to be discharged today. His parents are in the room, and he will be needing some discharge instructions along with some other tasks that I'm going to talk about in a minute. And then you have a patient in room 405, and this is a 5-year-old girl who has an upper respiratory infection. She did spike a fever at 3 a.m. and cultures were sent, and the initial dose of antibiotics was ordered and should be coming up to pharmacy any minute. And SATs were also dropping, and she had some difficulty breathing, and so now they have her on 2 liters of nasal cannula, and she is satting around 95% and 100%, so that's better. And there is also concern because she last voided at 2 a.m. Okay, so those are your 2 main patients. And then also you will have a patient coming up soon after shift change, after you're going to be getting report, and that's something that will also have to be thought about as you are planning and delegating. Okay, all right, so let's get started.